Since the introduction of the export authorization system, some 10 million doses had been exported from from EU to UK, and 0 doses had been exported from UK to EU. So if we discuss reciprocity, solidarity, and so to say global responsibility. So it's clear that we also need to look at those aspects of reciprocity and proportionality.
So what does this all mean? Let's get some analysis. Oksana Pyzik is a lecturer and global health advisor at the UCL School of Pharmacy. She's joining us from London. Oksana, lovely to have you on the show. Help me interpret this. I mean, doesn't this vaccine nationalism of sorts present very big risks for the EU's reputation, not only in terms of a champion for free trade, but also sharing vaccines worldwide?
Absolutely. There are contradictory messages that are coming out of the EU right now that goes against rules-based multilateralism that we heard von der Leyen calling for in her earlier speeches. So there is absolutely reputational risk that is associated with these types of suggestions, not only for vaccine equity, but also that even with these types of de facto export bans, what we would see is that it wouldn't actually make a significant increase in the rate of immunization within some of the countries that are hardest hit amongst the third wave. However, due to this increase across Europe of coronavirus cases, there is a lot of pressure on leaders to be appearing to be strong in protecting their populations as coronavirus hot zones start to reemerge. However, the consequences outside of Europe could be significant. And in the UK, for instance, if this were to go ahead, we could see some of our roadmap for the summer being derailed up to 2 months.
President Trump may be out of the office, but this sort of reminds me very much of a Trumpesque a trade war. Here's why I'm thinking that, because a lot of the EU sources a lot of its vaccine ingredients from other vaccine-producing countries. I mean, if this export ban is implemented, I mean, this could easily turn into a trade war, and that's exactly what you don't want in the middle of a pandemic.
Exactly. It's very short-sighted. We know that COVID will be with us for a long time, and this type of restrictions back and forth on exports, as you say, are gearing up towards a type of trade war that is very Trumpian in its language. Even if, for instance, there are other areas that perhaps do have less coronavirus cases, there are ways then to operate in order to ensure that vaccines get to those areas. And for instance, this sets a really bad tone for the COVAX facilities as well, which the UK has been the largest financial donor next to the United States. And so it sets a really dangerous precedent, I think, in terms of what will be acceptable. We know that for the global pharmaceutical supply chain is highly interconnected, and 70% of active pharmaceutical ingredients or APIs are actually sourced outside of the EU. So this could create further problems down the line for vaccines like Pfizer, BioNTech. There are many unintended consequences that could be triggered into action here should this political route be taken.
Oksana, tell me this. As a global health advisor, what would you like to see happening?
Well, I think that certainly we need to get a handle on the third wave across Europe and vaccination rates. As I've mentioned, there have been some stumbling blocks that are not just associated with the supply issue. Of course, collaboration, cooperation, and vaccine equity, equal distribution is what the WHO has been calling for to ensure that it's not just financial contributions that are being made, but jabs in arms. So what we need to also see is, in addition to supporting a more equal distribution, we also have to ensure that the public health messaging around variants, for instance, remains strong. And I think that due to just the sheer length of the pandemic, this is something that perhaps has been problematic, and UK in particular, there's been a lot of criticism around its border control and ensuring that better testing and tracing is occurring. So even with the current issues that we see in Europe, they need to be leveraging their existing public health infrastructure. They need to get GPs, pharmacists, and other healthcare professionals upskilled in order to deliver those vaccines. So it's not just a supply issue. There have been many failures across the EU in actually implementing the vaccination rollout. And so I think that part of this might be to detract from those failures.
All right, Oksana Pyzik, thank you very much for joining us here on the NewsHour. I do appreciate your analysis.